Confirmation today that community surveillance testing has begun throughout the country. Chief Medical Officer Dr. Roshan Parasram says one health center in each of the 8 counties in Trinidad and 1 in Tobago has been sending a sample a day for testing.
The Caribbean Public Health Agency will give me a disaggregated report for those particular patients as separate from the other samples they are receiving. Hopefully in the next 2 days or so we should start to see those results coming forward as well.
He says the plan is to expand on this.
Up and running, we will probably look at expanding because CAFA has to do testing both at the community level as well as our routine sampling. So they have, of course, some constraints, but once we get our sampling up and running, we'll be able to expand our community initiative in a week or 2.
Well, Dr. Parasram notes there are a few steps to complete before Trinidad and Tobago can do its own COVID-19 tests.
Is moving along swiftly with the training of persons and is scheduled to be completed hopefully in about a week's time. We already have the kits and equipment required. We already have begun the training of staff. We're in the process of having the validation exercise completed with CAFA. So in about a week's time, we will complete that process.
He says a video detailing the COVID-19 testing protocols will be made available in the coming days to lend clarity on the process. All citizens are being urged to present themselves to their health facility, virtually or otherwise, even if they have mild to moderate flu-like symptoms. There have so far been 114 confirmed COVID-19 cases here in TNT, but Chief Medical Officer Dr. Parasram notes that most patients only present themselves when exhibiting moderate to severe symptoms, though many COVID-19 cases are asymptomatic or mild.
Any epidemic, we tend to pick up moderate to severe disease based on the concern of the population. In the early days, something new, you tend to see an influx of people with mild disease as well, presenting to the facilities to be tested because of the concern of death and significant morbidity. So as complacency sets in, you tend to find people with milder disease don't present a test. But the concern is if you have a condition that starts off as severe, develops quickly at home into shortness of breath, especially with people that have diabetes, comorbid conditions, diabetes, hypertension and the like. We want you all to present us so we will know what we're dealing with at an early stage.
The Chief Medical Officer says the earlier these persons present themselves, the better their chances of staying alive.
Use the hotlines that are available to call in, and they will basically do phone surveillance to tell you if you're at risk. Make sure you present either virtually or otherwise to our facilities so that we are able to tell if you are a candidate for COVID-19.